One painful condition we treat in the office is shingles. So shingles often presents in this mid to upper back region. It usually follows a pattern along the rib. So it often follows like a nerve pathway. It can also occur though in like the legs, the lower back. We've seen it in the face, other regions as well. The problem with shingles, it's a very difficult condition to treat. One of the treatments we use in our office is called laser therapy. So what the laser is going to do, it's going to penetrate deep into this area to help calm down that irritation that the shingles provides, and that is what causes the pain. So what I'm going to do is I'm going to demonstrate what laser therapy looks like when we're treating shingles. So on our laser, we have specific protocols depending on the condition. So what we're going to do for shingles, we'll select spine. We're going to pick the thoracic region because that's where we see it the most often. And then we're going to select shingles. And so we're going to select this, and as if it's acute or chronic. Ideally, we see a patient as soon as you get the shingles because that will help get rid of it faster. So the treatment protocol takes about 5 minutes. It can be longer depending on the body part we're working on, but along the thoracic region, that's what it takes. So we're going to start the treatment. Now what the patient's going to feel like is just a mild warm sensation over the area. It does not hurt, actually feels really good if you're dealing with shingles. So when we're using laser therapy, the only thing we have to do is wear protective sunglasses over our eyes. So what we're going to do is we're going to demonstrate that treatment right over the ribs. So typically, like I said, it follows along the rib pattern there. You'll get some blistering and then you'll see some redness along that area. It'll be very painful to touch. Pressure with the clothing on it will cause a lot of pain and discomfort. And this is a great way to relieve a lot of that pain and discomfort and then also accelerate that healing process. Like I said, the problem with shingles is there's not a great treatment option for it once you have it. If you identify that you have shingles right away, there is an antiviral medication that you can take that will help calm down the condition. The problem is a lot of times people don't realize they have shingles until, several weeks later or a month later, and then they realize it's not going away. By that point, the antiviral medications do not work well. So there's not many other treatment options for shingles. A lot of times your primary care doctor will just say, it's going to go away on its own. Well, that could take several months. I've had a patient that lasted for a year, and again, it can be very painful. So depending on the location, this is a great treatment option for you. So basically, we're just going to treat this whole region. And like I said, a typical treatment protocol lasts about 5 to 7 minutes. So now what I want to do is I want to ask Renee what she felt like while we were doing this area. Obviously, she doesn't have shingles in that. Just describe what the laser therapy feels like.
The only thing I can feel from it is a little bit of warmth. It's pretty relaxing and soothing.
Yeah, and like I said, if you're dealing with shingles, it actually provides quite a bit of relief pretty quickly. And typically we treat this 6 to 10 times, but it depends on how long you've had it. Is it more acute or is it more chronic? That'll determine how long it takes to get rid of the shingles. So if you're suffering from shingles, give my office a call at 703-912-7822 or schedule online at novacarwellness.com.